Functional electrical stimulation with your TheraTouch EX4 or CX4 combo unit, utilizing either a symmetrical biphasic waveform or your NMS waveform. The treatment approach in this example will be functional electrical stimulation for the hemiparetic shoulder. The mechanism of action that we're talking about is to activate the supraspinatus and the posterior deltoid to create a force couple that produces superior migration of the humeral head during functional activities or tasks. The clinical example in this case is a patient status post-stroke with a hemiparetic shoulder subluxation. The dosing intensity consideration for this particular protocol or approach is sufficient intensity to create a palpable reduction in the shoulder subluxation. So we're looking for a palpable reduction of that subluxation with enough intensity to create a nice submaximal contraction of the muscles involved. First, we're going to select electrotherapy, manual operation, biphasic and symmetrical biphasic. Next, we want to make sure that we select the appropriate channel that we're using, and in this case, channel 1. And then we want to make sure that we set the frequency to 25 pulses per second. The phase duration to 200 microseconds. And the on-off cycle time of 10 seconds on and 30 seconds off. You'll notice here that is one of the defaults on the screen, so we simply select it. We already have the protocol pulled up on the screen. All we're going to do now is increase the intensity by touching that amplitude button on the screen to highlight it. Now we're going to slowly increase the intensity, and we should start to see, and the patient should start to feel some tingling. We'll have the patient let you know that's happening, and then we're going to now start to slowly increase the intensities to start to see a visible circulation and a contraction of the muscles involved. And we want it strong enough to facilitate the contraction we want, but comfortable enough for the patient. So let me know when it's a little too much. And then I'm just going to go ahead now and just back it down a few, because we're getting a good contraction here and a good reduction of that subluxation. It's on a continuous time now, so now we can simply do some very basic tasks, and we can progress at that point to more functional activities. But if you'll just reach out and touch my hand here, then maybe reach over and touch my hand here, and then maybe this location here, now back over here. So think of functional activities that you can incorporate while you're performing this functional E-stim protocol. I'll go ahead and stop the treatment. Let's talk about a couple of key considerations now for this type of protocol. Once the humeral head is seated properly in the glenoid fossa, the patient, as you just experienced, should be instructed to perform functional tasks and activities during either an on-time, or in this case we had a continuous on-time. Another consideration is that you can use a start and stop button on the screen while the current is in a continuous mode, so that you can provide a rest period. This is more of a manual triggered stim where the therapist or the clinician can actually control that on-off time.